A new local health insurance cooperative expects to lower health insurance premiums for Southwest Colorado residents by up to 35% in 2021. You're watching the Local News Network, brought to you by Tafoya Barrett & Associates and True West Auto. I'm Wendy Graham-Settle. The Southwest Health Alliance announced this fall it's ready to offer locally crafted health insurance plans with lower premiums, lower deductibles, and more healthcare services to residents in La Plata, Montezuma, Dolores, and San Juan counties. And the new competitive model has caused local health insurance carriers to lower their premiums by nearly 35% region-wide. The Southwest Health Alliance is an initiative of Local First and the Local First Foundation, nonprofits that address local businesses' needs through shop local marketing initiatives and other services. It operates as a purchasing cooperative in partnership with Peak Health Alliance, a health insurance cooperative in Summit County, to negotiate lower medical costs with area medical providers and hospitals. It works like this. The Alliance obtains commitments or endorsements from large and small businesses, healthcare providers, local governments, and individuals to purchase health insurance through the organization. The cooperative uses its large pool of consumers to negotiate with healthcare providers to lower their fees. The Alliance then submits the list of health service fees to health insurance companies to bid on premium for its members. As a result of the Alliance's ability to negotiate lower fees and offer lower health insurance premiums, spokeswoman Monique DeGiorgio said other health insurance brokers have been forced to lower their costs to stay competitive.
Not only have we seen rates go down, but we've brought some disruption into the marketplace, we've brought a new carrier into the marketplace, and we're pleased to say that we do believe that the Southwest Health Alliance premiums are going to be the most competitive as well.
Southwest Health Alliance worked with Bright Health, a national insurance carrier, to offer its new lower-cost insurance plans in Southwest Colorado. Consumers can choose from a variety of plans to fit their budgets, from zero copays and low deductibles to a range of copays and higher deductibles for lower premiums. Southwest Health will release insurance premium fees after they're approved by the State Insurance Commission later this month.
You will have the opportunity to shop local because you're going to see Southwest Health Alliance and Bright Health there providing not only super competitive premiums, but premiums that were handcrafted by us, the community, and have really, really important plan designs and benefit designs like $0 copays for mental health visits, $0 copays for your primary care visits. There are as many as you would like. There's even a $0 deductible plan. So we are just thrilled to offer this to any individual in the 4 counties.
We have things like MRIs and X-rays and things like that that normally you would have variable costs on, and because of the purchasing cooperative we were able to establish a rate for those charges, and so those won't be a surprise. You'll know exactly what you're going to pay for those. So part of this is that we have more transparency with what you're getting with the product that you have, which is not the way that normally insurance works.
Consumers can choose to purchase Alliance plans through Bright Health, through their own health insurance brokers, or through the Connect for Health website that the state of Colorado offers. Businesses also will be able to provide their employees health insurance through ICHRA, the Individualized Coverage Health Reimbursement Arrangement Program, approved by the federal government in 2019. ICHRA allows employers to make a tax-deductible contribution to their employees to offset health insurance premiums and medical costs. Employers decide how much they pay their employees for health insurance, and employees use that reimbursement to choose the Alliance plan that suits them best. In a case study of 2 businesses, the Alliance found that a local nonprofit with 5 employees could save as much as $10,000 a year. A commercial business with 11 employees and 10 dependents could save as much as $52,000 a year in health insurance costs.
We are reaching so many people in our community are uninsured or are unable to have insurance because of it's cost prohibitive. So I was talking to somebody who's a local body worker in town, and they were saying that they had only had a catastrophic plan. That's all they could get was a catastrophic plan. And I told them our rates, what the proposed rates to the Department of Insurance are. They haven't been confirmed yet, so we can't really talk about the specific rates. But what the rates that we did put out there are. And he was like, this is crazy. He's like, that's what I pay more than that for a catastrophic plan. And now he could actually have a plan where he could go to the doctor proactively and get help with things that he needs, get mental health and things like that that aren't covered right now with the plan that he has.
Ultimately, says DeGiorgio, the Alliance's efforts to improve access to health care through lower health care costs will result in a healthier, more economically stable community.
You start to see economies of scale if each individual is saving a couple $100s a month, and then you've got a business that has 20, 30, 40, 50 employees. You're going to see some staggering savings, and that money can get reinvested locally into things that are important, especially right now, like your mortgage and food and all of the bills that need to be paid.
Learn more about the Southwest Health Alliance and the insurance plans available at southwesthealthalliance.org. Thanks for watching this edition of the Local News Network. Listen to our news stories anytime, anywhere on your favorite podcast app. I'm Wendy Graham Settle.